Hi, everyone. I'm Andrea Tarr. I'm the program director for SCAN, and you are watching a special COVID-19 edition of Welcome to SCAN. And this is actually a three-part series, and today is part 3. So today my guest is going to be James Juliano. He's the Director of Therapy Operations for Encompass Health, which is in Tinton Falls. So James, welcome.
Good morning. Thank you for having me.
You know, the very first thing I do want to say, though, is that this special edition of Welcome to SCAN is made possible by the New Jersey Department of Health, the Division of Minority and Multicultural Health. I wanted to make sure I said that right at the top. And also, we want to say a good shout out to Encompass Health, because you guys have been a great sponsor to SCAN for many, many years. Okay, so here we go.
So thank you for having me, Andrea.
Yes, James. So first of all, please tell us about yourself and what is your role at Encompass?
Sure. So I am a physical therapist by background. I've been licensed in the state of New Jersey since 2011. I am the Director of Therapy Operations here at Encompass Health. So I oversee both our inpatient operations. We are a 60-bed inpatient rehabilitation facility. I also oversee our outpatient operations, through which we do have daily outpatient services, which run Monday through Friday. We see patients from the community of all different diagnoses and ages. I am a certified geriatric specialist through the American Physical Therapy Association. I'm a certified exercise expert for the aging adult, also through the APTA, as well as wound care certified. So I've been working with the neurologic geriatric population my whole career. And now that I get to see outpatient, I also do some of that with the community also.
Well, as you know, we've been doing, this is a 3-part series, and our focus has been telehealth or telemedicine, because obviously we said before, we have officially entered bizarro world, and nothing is normal. A trip to the grocery store is not normal. The bank isn't normal, and certainly not always normal now to see your doctor. And we've addressed the medical aspect. We've even addressed in part 2 kind of like the technical aspect, but now there's another part of telemedicine that people may not realize. You may be not going to your physical therapist to their office. You may be doing this over the phone as well.
For
so
sure.
Resistance is futile, because this is the way of the future, and this is the way it is now. So tell us about that process of doing physical therapy by phone.
Sure. So it's interesting because I feel like this whole kind of pandemic has accelerated the progress we were making towards something like this anyway. It's kind of kicked it into overdrive in this direction no matter what. You know, really what has come down to is people still require these services. People still need to make sure they perform their rehabilitation. They should be supervised by somebody who is skilled and certified to do so. And so in that sense, as we cut down exposure risk and community risk, doing it via telehealth or telerehab, however you want to call it, is the way to go. And it does really offer an avenue for a patient to receive certified supervision from their therapist, education on the spot, real-time feedback on what it is that they're performing, any questions they may have, any responses to their previous treatment. And it helps the therapist really determine, you know, do I need to see this patient, or should I refer you to perhaps see a doctor for an in-house visit? You know, being able to visualize somebody over a webcam and ask questions in live time really helps therapists make better decisions about what is this patient going through. Can we treat this via telehealth, or should I say, listen, I want you to see your doctor, or I do want you to make maybe a one-time visit to my office and kind of get this sorted out.
So some patients might say, and I'm trying to anticipate, well, all right, you're seeing them in my home. We're not in the gym, so I don't have, you know, all the equipment that I might have used if I were with you in person. So what are some of the things that somebody will be using in their own home?
So it's interesting. I feel like therapists, physical, occupational speech therapists, are usually pretty creative about finding ways to help people do the things we're asking without having gym equipment or a setup. So, you know, common household items very easily and quickly can become exercise items, whether it's heavy cans of tomato sauce, whether it's a frozen bag of peas in the freezer. You know, sometimes even taking a couch cushion or a pillow off of your bed to stand on it is a way to train for your balance. You're not standing on a foam pad like we may have, but it does kind of set up a situation where you're on and unsteady. And there's plenty of stable surfaces in your home to hold on to, countertops, heavy tables. Even most people do have some sort of light weights in their home, whether it's ankle weights or even hand weights. But if you don't, there are ways to make this work without it, for sure.
Or even, I think a lot of people probably have those I don't know what they're called, those stretchy bands.
For sure.
TheraBand. TheraBand, right. So that's another thing that you can use. Yeah. So you
Absolutely. And they're all easy to get.
So in a typical telerehab, that's my word. I don't know if that's the official word, but in a typical telerehab visit, how is that going to work? The therapist is watching you. You're probably setting the phone or the tablet down on a surface.
Yep. So you'd want to make sure you have all the sort of the nuts and bolts kind of ironed out, have an open space that's safe for you to perform any sort of activity in, make sure no distractions around, small animals, small children, whatever it may be.
Right.
But also, yes, have your video set up somewhere where you can be seen and communicate to the therapist at that point. And really, it becomes sort of a collaborative effort. The therapist will guide you through your exercises. They will guide you through the different activities they've asked you to do. And while you do that, the benefit of having a clinician watch you do that is they're looking at your body mechanics. They're looking at the biomechanics of what you're doing to ensure that what you're performing is accurate and is efficient. A lot of times you can do any exercise you want. It doesn't mean you're particularly doing it properly. So sometimes having that therapist there, or definitely having the therapist there to be able to say, well, let's tweak this, try a little bit differently is the benefit. And at the same time, as you're doing it live with a therapist over telerehab, any response that you have that's a possible pain response or a new response, you can immediately communicate that to your therapist and say, hey, this exercise made me feel X way. The therapist can use that to change your activity going forward. A lot of rehab and a lot of therapy is really about changing and progressing exercise and mobility as you improve and get better, and being able to do that in real time with a therapist while not being in the same room is the main benefit of having a telehealth service.
So do you feel like going forward, even after, the pandemic lifts slightly and people can go back to the doctor, go back to their physical therapist, resume somewhat normal, do you still feel like this will be a good way for people to do their physical therapy?
I do. And I mean, obviously we're not epidemiologists, but I think we can assume this is going to go on for a little bit longer, and people will be about exposure going forward, particularly people that are in high risk populations or geriatric populations. And I do think this is an effective and efficient way to reduce kind of community exposure. I think if we're, able to meet with a therapist via telehealth who can say, maybe in 2 weeks, I do want you in the office just for this one-time sort of evaluation or reassessment, and then we'll keep doing your telehealth visits twice a week, weekly, whatever it happens to be. That is probably what we'll see more and more of going forward in the future. And it's much simpler now than it ever was. I mean, there's applications that can be used. There are so many simple sort of one-click, two-touch ways to log into a FaceTime or any sort of application you want to use, that it's much less technologically a barrier than it used to be. So I think it kind of greases the skids to make this a little bit easier for anyone who, even if they feel they're computer illiterate or not so well-versed in any of this, and I think all of us at this point feel like that. I do think this is the wave of the future. I don't think it ever completely replaces in-person visits. I do think there's a need for some hands-on skills for sure. A lot of therapy or manual therapy need to have their hands on the patient. But I do think you'll see a bigger and bigger carve out for these types of things just to keep the patients, the community, and also really the therapist safer. The reduced sort of exposure is the goal.
Right. And I think of it also, if you're needing therapy and travel is an issue for some people, then this is a perfect way. And I also like the idea that maybe every other week, 1 week you're home, 1 week you're in the office. So there's many ways that you can make this work. So again, I think resistance is futile. Resistance is futile, as they say in Star Wars. But I like the idea of less risk, less exposure for people, especially because, at SCAN, we work with an older population. And some of the folks that have asked us about, which was the impetus for doing this, that is this going to be as effective as going to, be with the physical therapist?
That's a good question. I did want to mention that too, is as we have ramped up towards this sort of realm of telehealth, there have been studies performed about the efficiency and efficacy. Now that we're deeply into this pandemic, the studies have ramped up. And believe it or not, the research studies have shown via case studies, also some randomized controlled trials, that outcomes with patients using telehealth versus outcomes for patients not using telehealth have been extremely similar and really the same in a lot of cases. So there is a very effective way to administer care to a patient via telehealth that will get you the same outcome as if you were in that clinic 3 days a week. And there's a lot of guidance out there now as we develop this to help therapists of all realms determine what is the effective way to administer telehealth. What are the most effective ways to cue people? The most effective ways to teach anybody? You know, how do you determine what is the frequency of how often you see someone via telehealth? What's the frequency of when you do want to bring somebody back into the clinic? What are the situations where you want to say to the patient, I do want you to see somebody else? And that research is growing. And so far, the returns on it have been extremely positive. So I think that's very encouraging. I think that means that this is a viable alternative for now and for the future.
So we're learning from the patient side, and even on the medical side, you're learning as well, because this is,
Sure.
I think things like this, well, they certainly have existed, but the pandemic really just accelerated everything, as you said. So this is not going away, folks. This may just become the way that we are seeing the doctor, seeing the physical therapist, and it's not a bad thing. It's not a
No,
bad
it's
thing to do things from home.
No, and I've seen even here inside the inpatient side of our hospital, a lot of the doctors doing some telehealth visits and have been extremely effective and successful in doing so. And really, if the alternative is not receiving the service because you just are afraid to go in,
Right.
or you're face to face, it may be electronic, they may not be able to reach out and touch you, but it's face to face and they can give you a real time assessment. I think that's always a better route versus somebody being afraid to go out, which is valid. It really is. But I think this is something we should get comfortable with. I do think it'll continue to get easier, and it is definitely not going away. And I think all practitioners who participate in it understand the challenges of performing it. I think they do understand that patients may not feel 100% comfortable to do it.
Right.
They may be kind of cueing and coaxing. A lot of physicians' offices have become very good at putting instructions out about how to access their telehealth system. A lot of times they're hosting the software. You just kind of log in remotely from where you are. So it's all trending towards making it very user or consumer friendly, patient friendly. And I think they'll just continue to get more and more streamlined over time.
So any final thoughts, if somebody felt resistant, that you would say to them to make them feel better about not seeing you in person?
For sure. I mean, I can speak to this because I got into therapy as a student because to me, it was a very person related job. I love people. I love to work with people, be with patients. And I feel almost every therapist in the world feels the same way. I do want to assure patients that we can do those types of things via telehealth. We are still with that person. Maybe I'm not standing in front of you. Maybe I can't reach out and give you a tap or a grab or whatever it needs to be. But I am just as much there with you as if I was in person. And I think that all therapists will never kind of give up on that whole idea of therapy is about people.
In person,
And so
yeah.
and going into telehealth doesn't diminish that. I think we're still able to provide the services that are needed. And if any therapist felt that we were providing a lesser service or a less efficient or effective service, we wouldn't do it. You know, it's not about just making sure we're just getting the services out. It's about effective services and about keeping the community safe. And I really think that this is the way to do it. I know most therapists feel that way. And I think we feel almost in a way relieved that we have these capabilities now to be able to provide services to people who really need it and keeping them safe at the same time.
I agree. We have to feel fortunate that we live in a time of such advanced technology that this is real. So it is a good thing. Okay.
It definitely is. And it definitely can be effective.
Well, I want to say thank you very much, James Juliano, Director of Therapy Operations from Encompass Health. Thanks for being my guest today. You've been watching part 3 of our series on COVID-19 special edition of Welcome to Scan. I'm Andrea Tarr. Remember, if it's important to you, it's important to us. See you next time on Welcome to Scan. Bye, everyone.